Month is National and Kansas Breastfeeding Month. Tonight shined a light on that cause and the mothers who work hard to keep their babies healthy. 13's Claire Decatur's in our studio tonight. She was at the event and she has more for us.
Yeah, David, local breastfeeding coalition leaders told me the state's average breastfeeding rate is good, but there is still work to be done to remove all barriers for all moms. It's a unity like no other.
The bonding experience that I had, but also how it helped keep my spirits up after I had my baby.
It makes me connect with my baby. It makes me it's like the time for me and baby together.
These moms are a part of the nearly 90% who choose to breastfeed their kids. On Monday, local advocacy groups came together to celebrate World Breastfeeding Week.
This event, they can come in and get family photos done. They're going to get to meet each other, find out all the resources that are here in Topeka, which, by the way, is a lot. Topeka is rich with breastfeeding resources, and they can walk home with some prizes.
Before being a U.S. Senator, Roger Marshall delivered babies nearly every day for 25 years. He came to share with the group that he'll aim to be an advocate for health care for all Americans.
Putting my actions where my mouth is, we appropriated $50 billion in the big beautiful bill. Part of that will go towards rural hospitals and so part of it towards community health centers.
Kansas Breastfeeding Coalition Executive Director Brenda Bandy says they're calling for some policy changes at the federal level.
I think our favorite policy is really paid family leave. If more families could stay home after the birth or adoption of a child, we know that breastfeeding would get off to a better start. We know that our insurance providers, whether it's Medicaid or private insurance, really can and should do more to cover lactation support and breast pumps that families need.
And resources in the community are there for moms now.
I took the resources from the WIC office too. I talked to the WIC office counselor, breastfeeding counselor.
Search those resources, see what's working out there in the community, and if you need something, know that you're not the only one who's ever needed it, and so ask those questions.
We'll have a link to the resources on WIBW.com.